Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi, this is Mitch Ghen, and this is the final installment about fatigue and pretty much some of the treatment options. I can't go through all of them, that would be impossible, but certainly give you a little bit of a hint. For example, if the thyroid profile shows abnormalities, you should support the thyroid with things like iodine, selenium, zinc, tyrosine, and of course, if necessary, actual T3 and T4. If you see inflammatory markers that are elevated, as we talked about before, then using curcumin, metabolic enzymes, aspirin, and other non-steroidal anti-inflammatories would be an appropriate response too. If hormones are abnormal, then of course, if it's a catabolic state, reactivating the anabolic state with DHEA, pregnenolone, estrogen, testosterone, and things of that nature would make sense. And of course, if you find states of metabolic abnormalities such as diabetes or close to diabetes, berberine, gambrosia, chromium picolinate, moringa are also excellent choices. I don't think much needs to be said about electrolytes or electrolyte formulas of all nature that are both over-the-counter as well as medically prescribed. In adrenal fatigue, vitamin C and herbs judiciously, that is, because adaptogens stop working after about a month. And where necessary, just the actual replacement of the hydrocortisone molecule may be needed by using that type of medication. Autoimmune diseases, at least get rid of the food colorings and the preservatives, low-dose naltrexone. And again, DHEA is extremely helpful. And if someone has a methylation problem, of course, use the methylated B complex and folate, and consider using the alternative pathway methyl donor, such as things like choline. When blood viscosity is of issue by elevated fibrinogen, increasing the amount of water someone drinks, aspirin, nattokinase may be a perfect addition. And if you're seeing some sort of microbial problem, silver, luteolin, drugs like ivermectin would be helpful. And toxic metals, match the metal to the chelating agents. There's something called a pKa value, and you should study that because that will tell you what works best for what. And if the gut is not healthy, and then you can replete it with probiotics and prebiotics, of course. And of course, is there any pathologic organism or overgrowth, natural or commercial agents, prescriptions would be depending on the sensitivities that are given to you by the company that does that. And nutritional deficiencies can be addressed by vitamins and CoQ10 and anything that can that causes reduction of ATP should be added back in, such as B12 folic acid, and of course vitamin D. And if there is medications involved in the patient, then review all the medicines. And if you're not sure, look up and see what their drug-nutrient interaction is. It takes time, but it will be ultimately the benefit, of course, of your patient. And evaluate how much water the patient drinks. Tell them to keep a diary and then replete them according to the things that you have learned and how much should be used. Remember, this is all about the patient at the end of the day. It's complex, but now that if you can understand that fatigue is part of pretty much every single disorder that besets humankind, and how to just get an idea of how to work this up, you're going to be very successful in your treatment, because even if you don't know every single potential natural and medical treatment, at least that could be easily identified and looked up. Thank you so much for watching this series. I'm Dr. Mitch Ghen.